alluded to how the discovery of dapsone, and particularly the new protocols that you've developed with the higher dose dapsone, have made a difference. But what are you seeing with these people who have been sick for so long? Tell me about that.
Yeah, so the model that I've developed after seeing over 13,000 chronically ill patients during the last 35 or so years, the model that I developed is an integrative model. I call it the 16-point MCIDS map, and MCID stands for Multiple Systemic Infectious Disease Syndrome. And what it is a way to deal with these really complex patients in a very logical manner. So, for example, the analogy that I use is a patient goes into a doctor's office with 16 nails in their foot and says, "Doc, I've got foot pain." And the doctor pulls out a nail and says, "Come back in a month." And of course, you're going to come back with foot pain. So on the 16-point model, 6 out of these factors of the 16 are inflammatory. So what are these inflammatory factors? Number 1 is the infections, which I call the 3 Bs: Borrelia burgdorferi being Lyme disease, Babesia, and Bartonella. Those are the 3 most common infections that we're seeing at this point. But we're also seeing a lot of environmental toxicity. Mold and heavy metals are showing up in the vast majority of our patients. And the problem is, not only does it cause an inflammatory response, but it mimics exactly the same symptoms that we are seeing in our Lyme patients, except for some very basic symptoms like migratory pain, which is the hallmark of Lyme. But otherwise, fatigue, brain fog, neuropathy, psych issues, you can see it with mold and heavy metals. So that's the second factor. The third factor on the list is that the Lyme patients don't fall asleep. They can't fall asleep. They keep waking up in the middle of the night. They have a form of a circadian rhythm disorder called delayed sleep phase syndrome. So these patients also drive inflammation with increased interleukin-6 production because they just can't get to sleep. So that's the third point. The fourth and fifth deal with the microbiome. So we're seeing the wrong type of bacteria, too much Clostridium, too much Prevotella, not enough Akkermansia species that are showing up, or they've got things like leaky gut with multiple food sensitivities and mast cell activation that's happening from the Lyme, from the foods, from the mold. And finally, there's a lot of nutritional deficiencies that are showing up, so they can't detoxify the chemicals and the toxins that are coming in. So I kind of tell people it's almost like there are these rivers of inflammation causing an ocean of inflammation. And we know that the reason Lyme patients, and actually most chronic fatigue and chronic illness patients, it's always inflammation that's driving the underlying process if you can figure out what's causing it. So when we look at these 6 rivers of inflammation causing an ocean of inflammation, the downstream effects are mitochondrial dysfunction, because the mitochondria have nothing protecting them. People get POTS dysautonomia, postural orthostatic tachycardia syndrome. We're seeing it in long COVID, because it's the same thing. It's the 3 I's. It's infections, immunity, immune dysfunction, right, and inflammation. So whether the infection is Lyme or whether it's COVID, it's causing the same downstream effects. We're getting hormonal dysfunction with low adrenals, mitochondrial dysfunction, POTS dysautonomia, liver problems, neuropsychiatric issues. So in other words, it's actually a very similar pathological process. It's just, of course, the infection is different, but the downstream effects are similar. So by laying out this map for the practitioners and going through it in detail, and then, of course, going through these new protocols with dapsone, what I hope, and I'm sure we will accomplish it, because you're giving me more than enough time to do these presentations, I will be downloading essentially how to make the diagnosis, what are the best tests for Lyme disease, how to use the validated symptom questionnaire that we published in 1,600 patients years ago with New Pulse researchers, and then how do you use these new protocols? Because a lot of the docs, the functional medicine docs, they're worried about the microbiome and they don't want to give antibiotics. But these are short-term protocols. Dapsone is a 9-week oral generic antibiotic protocol. And the ones that don't go in remission, about 30% go in remission after the first round. The ones that don't, it's 2-week pulse therapies. And it's basically been described in detail in the article we just published in Microorganisms in September 2023. So I'm going to make sure people have the confidence to use dapsone, they understand the side effects, and they understand why they need to be pulsing these antibiotics with these persister-type bacteria, because these are bacteria that are dormant or very barely metabolically active. They're under biofilms. So if you're just giving herbs and you're not opening up the biofilms and you're not using persister drugs, you're just not going to get rid of the infections. So you can learn all the functional medicine tricks you want, I guarantee you, because I've been to IFM, I've trained IFM doctors. I can tell you right now, your patients are not going to get better. You must understand this epidemic. You must understand Lyme Babesia Bart. Otherwise, you're going to have a tough time getting these chronically ill patients better. So I think it's going to be really a wonderful conference. It sounds like, we'll be able to really download some tremendously beneficial information so doctors walk away with the tools they need to really help their chronically ill patients.
Well, thank you so much for agreeing to speak and for chatting with me today. I am so very excited to listen to your lectures again. I have to tell you that one of I think was my first ILADS. I heard one of your lectures and it just blew me away. I learned so much. So I know that this will be just like that one was. Every time I hear you speak, I learn something more and more. And you have opened up the world, I think, for practitioners to understand how to get our patients better, which is what we all want and we all struggle with. So thank you for your time today. Thank you for speaking in June. We're really looking forward to having you here.
Now, I'm looking forward also, and I've never been to Asheville, so this will be a great time for me to take a couple of days vacation. And also, I hope to meet new people. For those of you who've never met me, who are integrative functional, please come to this conference. I'm looking forward to meeting you and sharing experiences, because we're all brothers and sisters in the field trying to help each other. I think it's going to be a great social experience as well as a great learning experience.
It is. It's a super fun conference, and Asheville in the summer is gorgeous. So hopefully you'll enjoy some nice vacation time as well. Thank you again, and I'll look forward to seeing you.
It's my pleasure.
Bye.